I want to welcome everyone to today's HEAL event. This art event, Routine as Repertoire, is a continuation of our programming here at the medical school. It's part of our mission at HEAL to align the work of artist patients with the work of our core curriculum, the work that our students are doing in their studies. And we do this in order to foster enhanced understanding between patients and future healthcare professionals. So it's my pleasure today to welcome San, who's going to be in conversation with Ted Meyer. I'll let Ted, our artist in residence, do a more formal introduction of her. And I'd like to also introduce Dr. Pamela Mikkelsen, who is an assistant professor of clinical physical therapy and will be our clinician discussant today. And it's wonderful to have you here. Thank you so much for being here. And I will turn things over to Ted.
Hi, everybody. Thank you all for being here. I'm really excited about this talk because I'm usually, I talk to 2D artists usually who sort of paint their experiences. And I came across, well, San and I had met a long time ago because there's sort of a network of people who deal with illness and art in different ways. And San had approached me just about her work in general. And in the meantime, had done this very monumental project with people all over the world, talking about movements that they were doing to help them recuperate, which was a whole different world for me. But then I started thinking about my recuperations over the year, and it made total sense to me. So, San, why don't you first start and talk about your cancer and your treatment for that and how that got you into the idea of repetitive movements and routines as a part of healing.
Yeah, thank you, Ted. Thank you for everyone for being here. So I went to so the project Routine as Repertoire began with my own cancer diagnosis in 2015. And the care work that followed the changes in my body. So I was diagnosed with stage 1 endometrial cancer and had a full hysterectomy with bilateral, I can't even pronounce this, bilateral subpingual oophorectomy. And also I had some lymph nodes removed. And after the surgery, I went straight into surgical menopause. And I developed a lymphedema on my right leg. So, so I woke up in the hospital and immediately I felt this whole gush of heat going through my body. So in a way, there was an awakening of the body that I didn't realize, like I didn't really pay attention to. So, and what I also didn't realize that my body was grieving for the loss. And I think, everything happened so quickly. And so in many ways, this project became, at that time I didn't realize, but it was my healing process. So I was not, I was thinking a lot about routine because I was very, very frustrated having to deal with these changes in my body. So on top of the pain that came with having, a very hypermobile body. So I remember when I first woke up, I remember waking up in the middle of the night when I was first diagnosed with lymphedema. I started measuring my legs to see if they were growing bigger. So I was kind of using my eyeliner to kind of do this measurement. So my legs became like a ruler. And I think I was really anxious and I was learning how to wrap my legs every night. And, some nights, like in the beginning, it took me 2 hours to try to wrap and then do the massage. So I was like, I'm just spending my time doing all these things. And I got really frustrated. But what I realized is also this process, this repetition was somewhat also, it stopped me from moving too fast. And then, I started talking to other women and in, with different kinds of experiences, and they were also sharing their routine. So, and that's how the idea of the project came about, because routine is something that so often is unseen. It can be very personal. It also can be very banal, but then it's also actually a lot of work that people with changes in their body or challenges in their body put, in every day. And so one thing that I would really like to say is that I'm only able to do this project because of the generosity and the wisdom of those who came before me and those who have filmed or I've spoken to. So I wouldn't have photographed myself. And this is the first time in any of my art projects that I filmed or photographed myself. And I'm only able to do it because of the other women and non-binary folks who share their experiences.
So I want to bring Dr. Mikkelsen in here. So you have a dance background. So as we look at some of the videos of the repetitive movements that San's going to show, feel free to chime in, and because it seems to me that there's sort of a dance to this. There's a muscle training and something you get comfortable with. And I could be completely wrong on that, but I think of my rehab over the years and how it's been a matter of relearning things and doing them over and over again until the muscles feel comfortable with it. And I know that there's also an emotional, and San can talk about that with some of her experience with these people, sort of a comfort in doing the same thing over and over again, which to me would almost seem like when you were performing as a dancer right before you're going on stage, knowing that your body is going to do what you want it to do in front of people. So why don't you start showing a couple of the videos.
Yes.
And then we'll have a back and forth between everybody at that point.
Yeah, okay. So I'm going to share my screen.
And there's a way to look at movement, like any movement can be dance, any movement can be considered choreography. And the way that I look at movement with my patients is that they have their set choreography that they do. Sometimes we need to alter it because their set choreography, their movement patterns are not ideal for what we're trying to achieve, and they can be potentially harmful and contributing to pain and injury. So we change that choreography, we change that movement strategy that they're using all the time in order to just allow them to move better and allow them to make progress in their functional goals.
So how long does it normally take for someone, like if you and I talked earlier about, I had a limp for years, and then when I had a hip replacement, I didn't have a limp. And it literally, I mean, it's been 22 years and there's still times I get up, if my leg falls asleep or something, and the first few steps I'm limping, I'm like, well, that feels normal to me,
It all depends on what's causing the change in the movement or the certain movement pattern. If it's just like an external constraint, like I don't have the range of motion in my hips, so I can't walk the way that I would typically walk or that someone else would typically walk. If you change that can change the pattern. If it's more of a strength issue, you need to work on the strength, and that takes 6 weeks to build up any sort of muscle bulk itself. It all depends. I can change movement in one session if it's just the pattern that I'm trying to change, and say, oh, use this imagery instead, think of this instead, think of a wave coming from behind you and lifting up your arm instead. That can change the movement in a minute. It all depends, which my students always dislike me saying because there's no definitive answer.
As with most things in medicine. All right. San, why don't you start running through your thing?
Yeah,
and
I'm going to
comments.
Right, I'm going to run through some of the slides, and also I'm going to speak specifically about dance. Since I know we have two dancers at least in the audience. So this is one of the image from Routine as Repertoire, and it is a light painting of Susan Trackman, who was, I think, also gave a talk last month. And she lives with multiple sclerosis. And one of the routine that she shared to me was that she, every week, she loads her pills. So in a way, the routine is also to make her life like there's so much to do every day, for care. And so it's also being very efficient, it's like, okay, I don't have to do it every day. I load it once a week. So there is, routines can be a mix of so many different things, and it can also be something that just makes, like I see a lot of resourcefulness and a lot of adaptability in the routines. So, so one of the reasons that I wanted to use, to talk about this, to use routine is also to allow us to look at disability and other different kinds of transformations in all its complexity. Because so often the narrative is very binary. It's either like, oh, you have this, it's very tragic or very heroic. So I hope to go, I hope that by showing very everyday movement, we can see these individuals as very complex, beings like all of us, and have this wide range of experiences. So this is the photo that I was talking about, that I photographed at the end, after filming many of the women. So it's me in, I recreated my college dorm room in Singapore in my room here, because I pasted a lot of these like very perfect, so-called perfect, and bodies on the wall. And in a way, it's my address, it's my own acceptance to the body, with my own body and the challenges that I deal with. So Susan, spoke about routine. Routine are important because they give me a structure in my life. They also allow me some control over parts, life and parts of my body that I'm not able to control. So the routines can be both physical or mental. And so this is a shot.
Before you go on, let's go back to that photo of you wrapping
Okay.
your leg again, because
Okay.
so what was your routine here? You said it could take a couple of hours. So
yeah, so now it doesn't take a couple of hours most of the time. So I in the beginning I was doing a lot of lymphatic massage. So it's like an hour long. So I tried to kind of push this lymph fluid that makes my legs swell up my body. So, in a way, it's a very, very gentle massage. And I have to be very in touch. I can't do it too hard. But last 2 years ago, I got a pump. So sometimes I'm kind of lazy to do that. So I use the pump and I kind of lie in bed, and then and then I let the machine do its job. And it's not as effective as going to an actual lymphatic therapist. And then I wear compression almost 24 hours a day. At night, I wear something else. And in the beginning, I was doing like full-on bandage very often to stop it from swelling. So, to kind of try to reduce the swelling. So I put a foam, and then I wrap with, I don't know how many yards of like just layers and layers of bandage to try to hold on to it. So in the winter, it actually is fine, but I think in the summer it gets really hot when I have to wear different compression.
and did you have a set time every day, or just whenever you fit it in?
I like now I don't do these bandaging every day. So in the beginning, I was doing it every day. So now I do it at night when I'm going to bed, but I always wear compression. And then, and then if I'm pumping my legs, it's at night. And when it gets warm, that's when it gets worse. And I have began to swim a lot more. So I've been, so in a way, swimming is like natural compression. And I realized that if I swim more, my legs actually feel better. So I have incorporated things like I swim 3 times a week for an hour and a half. So that helps with the lymphatics. Yeah.
Okay. All right.
So this is so one of the, yeah, so this is like, you know, taking pills can be also a routine. So there's a short clip on it. So, you know, playing mahjong could be a routine. So the emphasis is that, I mean, of the project is that routine may look so different from different people, and there shouldn't be any form of judgments to what your routines are, or whether you can follow a routine, because very often being able to follow a routine is also comes with a kind of privilege of time, of resources. So part of the project, this is Erica, she was stabbed. She has 17 stab wounds, and she lost her son, but also lost her ability to walk. So her new routine, even to wear a pair of shoes, takes a lot more time than before. So that is, you know, what I hope, you know, that can come across in the project, that, you know, these routines could be both physical and also mental. So like meditation, I mean, I have a meditation practice. So these are some routines. Yeah, so yeah.
Something that you said gave me goosebumps, saying that these routines shouldn't have judgment.
Mm.
And it sort of speaks to one of the things you said in your opening sort of introduction about being frustrated with the changes within your body.
Mm.
And how that can really impact recovery and life and enjoyment with new changes when presented with new pathologies or progressions in diseases. And I absolutely love this work for that reason, is that it sort of looks at this in a non-judgmental, almost reconnective way with your own body and your own experience throughout the world, or throughout living, that will definitely differ from another person's. And I deal with that a lot with patients on the psychosocial mental aspect.
Yeah, thank you. Yeah, I mean, I want to emphasize, you know, in the project that not even, you know, sometimes we break so-called routines, right? And also routines always change. So this is, yeah, so I think just talking about routine is just a tool for me to talk about all these different things that I hope could open our minds, you know, to being open to different kinds of people who have different experiences as us. And I think that is really important. And also for ourselves, you know, for me, like not judging myself or not being so critical about my own body or trying to control it all the time. Yeah, thanks.
Absolutely, yeah.
So,
Son, I'm also going to have you, as the artist have, talk about, like with Susan's photo in this one, how you captured the movement in the still photos.
Okay, yeah. So I made a lot of still, I mean, for many of the women, I make still images of so-called light paintings. So they are long exposure. So what I did was that I put lights on Susan's hand, or I put lights on like the wheelchair or the legs. You know, when there's movement or non-movement in the meditation project, you can see that the light doesn't move. So I'm referencing this. I teach history of photography too. So apart from being a photographer, so I mean, I learned about this images by this Frank Gilbert in early photography, where he tracks workers' efficiency by attaching lights to their hands. So in a way, what they do is that they try to control your movements, you know, by, you know, like this is the most efficient way of doing something. So what I'm hoping to do with the images of, you know, the participants or my collaborators in my project is that now they are doing all these, you know, with autonomy, and, you know, this is for their own care. This, you know, whether they, you know, whether it's taking pills or going through chemotherapy, you know, or dancing, you know, so this is something that, so I'm trying to retake that, because I feel that, you know, the controversy of Gilbert's images was that it was to control the women's, the workers', you know, way of moving. So yeah, so I do long exposures. They're about like 2 or 3 minutes, and so these are some other images. So I put so this is Anna, and she is going through menopause, and she used to be a dancer as well. So she's an artist, mother, and educator. And for her, like sweeping the floor in the desert, right, is a physical work that she feels that she can still manage, you know, that she uses to manage the physical and emotional effects on menopause. So I put the light on the broom. And so, I mean, she's a painter, so she kind of creates this really beautiful kind of flowers that I wouldn't be able to. So this is like, you know, the space itself. And Vivian, I'm just giving a few like example, but I will also share the website where you can actually see all these in details. So Vivian has been blind since she was 20, and she was told by a doctor that she would die of complications. So she learned how to swim at 50, and so she won hundreds of medals, you know, in senior games. And she actually started a foundation to teach people in her community how to swim. So I photographed Vivian and her husband Turner, like they live in Riverside, and she starts swimming 3 times a week at 5 in the morning. So every, you know, and then 3 times a week she goes to the gym. So she, you know, so I put lights. I had to waterproof the lights. Actually, I messed up some of the lights in the process, and kind of charts her movement. So this is there's a very short clip of her. Yeah, so and so in the project, there's little, so I interview everyone in the project, and I ask them to talk about their routines. And in the online exhibition, I just put really small clips. I mean, there were a lot of materials that I'm hoping to use them all, but I have little clips. So I mean, you can go on the website to hear the interviews, and each of the videos has some sound. Eva, I saw, Eva is a queer disability activist and sex educator who lives with cerebral palsy. So she is also a partner, a pet mom, and a coffee lover. So a lot of her routines is they are intertwined with that of her aide Cameron. So so for most other people, I actually put a separate light. Where else for Eva, because she uses she's nonverbal, so she uses a laser pointer to kind of point to the different charts in the house to communicate. So that is the light from the laser pointer. And I have portraits as well. And little clips of like physical therapy. And this is Eng Chu Eng. She's in Singapore. So this project is made both in Singapore and in the US. And so this is her doing Tai Chi. And Wendy has stage 4 inoperable cancer. So she takes traditional medicine. So I filmed her taking medication, but also she started going on these long walks. And so I put the lights on her legs and, you know, I followed her on her walks. And one very important routine that many of these women, you know, shared is that they started, you know, building community. So routine can also be building this support group where they, you know, she started the Singapore Sarcoma Support Group, and she actually, you know, give information to other patients who are going through similar things as her.
I love that. I love that image. If you don't mind going back for a quick second, that if you're looking at this movement with a different context of just movement, and maybe there was a little bit of a stumble or a deviation in her walking, that would seem as imperfect, but those imperfections are what make this image interesting. And allow you to, instead of judging like I'm not walking perfectly, this goes back to the whole non-judgment concept, that this is just how I'm able to get from here to there right now. This is my art in movement. I love that. Okay. That just stood out to me. Thank you.
No, thank you. Yeah, so Nicole lived with, she's an autoimmune disease, rheumatoid arthritis. So she, you know, does yoga, you know, she manages her energy and stress level. She plays with the dog, she walks, you know, and she makes her own skincare because the medication really affected her skin, and she gets really sensitive to that. This is Jacqueline, you know, she loves going to the flower shop. She's also an artist. So she goes to the flower shop to buy flowers for her grandmother, who she's making a project together with. So this is one of her routine. Meditation. Yeah, and maybe I can use this time to just share just a short quick link to the website. And so I hope, you know, sorry about the sound, but hopefully you can check out the website. It's routineasrepertoire.com. And it is an online exhibition because of COVID. Initially, I envisioned this project as like an installation, but then somehow I think I love that it is actually online, you know, in this form. So there are texts, there are videos. I also want to share, you know, like Susan, she's here. Also, she's joining us in Zoom. And actually she has, you know, one of her routine is swimming, and, you know, kind of doing a lot of the movements. She feels free, you know, in water. And maybe Susan can add on, you know, on the chat issue, yeah, to correct what I said. Also, another person who's here is Vanessa. And yeah, Vanessa, so that we, you know, she's being, she's being interviewed. And because of COVID, I was unable to film her in person. So she shared, and I think these amazing videos of her practicing her dance. So she's the first disabled dance major in Cal State Long Beach. And so I'm just going to show the clip. And she shared that, you know, I mean, for her, her passion is dancing. So she has to do additional warm-ups, you know, in order to achieve her goal and her passion of dance. So the routine of dance is not, is not because of her condition, but this is because this is her career, this is her passion. So she may need to do more stretching, and she talks about that in the video. And during COVID, she's not able to dance with her walker. So, and she's confined to a smaller space. So she started going back to this area in her bathroom that she always practiced as a kid, where she feels like the floor is right. This is where I can move and I can be creative in my movements. So, yeah.
Cool. All right.
So yeah, that's I mean, just yeah, that's the, I mean, actually just that's the end of the, I mean, this is just how the website goes. So hopefully you can take a look, and there's also a call for submission, because I'm trying to make a archive or a catalog of different routines that different people with different conditions have to incorporate. And, I think a lot of women or people who saw the project, tell me, oh, I saw this and I do this too. So I really connect with it, and I feel less alone. So I'm trying to have different kinds of routines. So yeah, thank you.
Okay. We can end your screen sharing now and go back. So I want to ask both you guys, and then eventually we'll try to get to some of your subjects here. So you had only, I just thought of this while watching the videos, all females. And I'm wondering, Dr. Mikkelsen, if when you're dealing with male patients versus female, is there a difference, in any advice? Also, remember, we have med students watching us. So is there a different way you have to deal with men who are expected to be strong and, always healthy, as opposed to maybe all her female subjects?
I will say there's differences in approaches to different personalities and different identities. So you can generally categorize male and female. You can categorize queer, non-queer, binary, non-binary, etc. But my approach is fairly similar in that I'm trying to, when I'm interviewing a patient, when I'm looking at them, when I'm connecting with them, I'm trying to understand what they value and what they see as important to them. So like with some of the subjects that Sang presented, like yoga and dance and being a dog parent, like those things are important to that individual. And that's what I try to get at, to understand the person, to recognize how to approach them. There are some both male and female patients that are really resistant to the idea of like mindfulness and meditation and paying attention to your body throughout the day. Regardless of gender, that's the identity and those are the values that they have connected with. So I have to recognize that and then determine how to get around that if I think that, presenting mindfulness as a treatment strategy would be appropriate for them. So it's not so much a gender difference, it's just, what does this person as an individual truly value? And that's some of the best advice that I give students too, is recognizing that. And then you can make huge changes by meeting them where they are and supporting them with what they want to go back to.
So, and another question for you. I mean, when people come to you and they've lost some mobility, is there, and again, this is sort of a question for the med students watching, how do you talk to them about their new normal is not going to be what their old normal is?
The first step is validating their frustration, validating their concerns about not being able to be the person that they see themselves as. I work with a lot of patients who have migraine and persistent TMJ dysfunction, and a lot of that is stress and really debilitating for them. So validating that the path will be frustrating, you will have to find new ways to do what you want to do, but never telling them that they won't be able to reach the goals that they're trying to reach. It might look a little bit different than what they were envisioning, but we will work our darndest to get back. I worked with a dancer who had an accident and had pretty much a complete spinal cord injury. And we worked to get him to be able to stand up at his counter. Granted, it was him leaning on the counter so he could make coffee, but he felt like that, like if he could do that, he would feel like himself again. So it looked different than what he was envisioning in the past, but he was able to do it and he was ecstatic about that. So just being upfront, transparent, honest about the expectations, the realities, but we'll work together to meet whatever goals you're trying to meet.
And San, did you find any of your people sort of part of their routine is accepting their new realities? Oh, you're muted. There we go.
Yeah, I think, so most of the time when I meet with, when I film, I talk, I spend quite a lot of time talking with, our experiences. So yes, a lot of the process is about accepting, their conditions, and a lot of them do it also, by kind of connecting with other people with similar conditions, and in a way they feel that by supporting each other, they are able to make something out of their experience, and they share it with, I mean, it seems like, based on the 25 different people I've filmed, and actually more now, but it seems that that is a way, like, find like community and like help with the acceptance. But yeah, so it takes time to gain acceptance, and also some people get it, to do it really quick, and some just need more time.
Dr. Mikkelsen, I always ask the doctors and our experts this, and it sort of seems like a natural jump from dance to what you're doing, but let's talk about the type of person you need to have your specialty. And I mean, I'm assuming there's lots of physicality and touching people and helping them move. And so what sort of personality do you need to help someone get their movement and routines back?
It's a really big question that I don't know the answer to. So for my profession, we work with patients fairly regularly. So we see them once, twice, 3 times a day in the outpatient setting, more frequently on the inpatient setting. And you have the opportunity, which is kind of the benefit of my work, to truly connect with people and make a difference in their everyday lives. Like all health professions, we just work on a much more intimate level on a regular basis than some other health professions. So in doing that, there's a certain amount of vulnerability that can be beneficial from both the clinician as well as the patient, and being able to truly connect. Not to say that you don't also need those barriers to maintain boundaries and to maintain your own sanity, but that willingness to really see another person, to not judge them for what they want to get back to doing, for not judging them for how they got into the position that they're in. Breaking down those judgments is one of the key pieces. The physicality, sure, being able to like push on something and get a joint to move, that's like the mechanics of it. The true art comes from really seeing the other person and giving them what maybe they don't even know that they want, but you can see their desires sort of creeping in with how they present their challenges.
And San, did you notice any difference in people being able to accept their movements and things in the 2 cultures? You said you did some of it over in Asia and some of it here.
You mean difference in between the culture?
Yeah, is there an expectation of sort of perfection more over there than here, or did you find it to be the same?
I don't feel like that was very specific in terms of culture, but I think sometimes articulating desires could be, one of the, difference. I mean, in many ways, a lot of the people that I have filmed have already done so much work on themselves. So I mean, I organized a talk where it's about, why do they choose to share these like so-called vulnerable and intimate moments in the public sphere. So, that itself is, in a way that they have, I mean, and they were actually all of them, whether they were from Singapore or in the US, they were really articulating their acceptance, but also, their, in a way, so much of it is their resilience and their strength, that even just putting all these out there is like, I mean, I don't know, it's, I think it inspired other people, but also maybe it also gave some of them confidence as well.
So I'm going to ask Susan or Vanessa, who were part of your project here. Had you guys thought about this idea of routine before she approached you to be part of the project? Maybe Susan?
Yeah, no, I definitely did. San, I must commend you. The way you approached it was really beautiful. I think we had an immediate conversation about the word routine, and we kind of bumped heads on that because I didn't like the word routine personally. I was more aligned to ritual, and ritual in a kind of an individual sense of agency in that kind of way. But I understood why she was using it. It's very interesting listening to you today about how you're using it as a specific tool. I love that. But you have a stunning way of opening yourself up and what your entry point was into it and your interest, that it allowed me, and I'm sure the other people, to just feel incredibly at ease to have a conversation, to allow the conversation to expand of what it was. Yeah, and I enjoyed it thoroughly. I personally, what I do with swimming, and unfortunately I cannot swim here. In Singapore, I was incredibly privileged to be able to swim all year round and to have pools open all year round. And only for about a month and a half through the lockdown, we were exempt from that. So without that kind of landing for me, it is a ritual in which I feel myself, or I feel more at home with my body, even though I am a dancer. But in reality, the metaphors of fluidity, I work somatically, align with my way of being so much, and not being able to utilize that ritual on a daily basis is very difficult. Yeah. So I try to do it through other kind of meditative works, but I've lost a lot through that, truthfully. So I was aware of it, and we had a communicative about that. But the way you unpicked it, I thought was extraordinary. So thank you so much, San.
Thank you. And I think Vanessa in the chat kind of answered Ted's question. And I can read it, but unless she wants to elaborate more on it. But I mean,
yeah, hi.
Yeah, okay.
Hi, everyone. My name is Vanessa Cruz, pronouns she, her, hers. Just a little background of myself. I am a physically disabled artist, choreographer, dancer, student, currently last semester at Long Beach. I'm excited. San came up to me before the pandemic, actually, via Facebook, and she messaged me. She was interested in my work and talking about routine, but as dancers, it is incredibly hard to find time, even for ourselves with rehearsals and everything. So I didn't really get a chance to do it before the pandemic, but I was very fortunate to have had this experience with her, even in the midst of a pandemic. to discuss how I do the things that I do as a physically disabled dancer. And I really loved what, like Susan was saying, her approach, because I was able to dive a little deeper to the way I warm up before I take a dance class or more rehearsal, and what that means for my body. And over the time, I feel like because as disabled folks, we tend to want to assimilate to a non-disabled world, it can be very exhausting to our bodies. And so I'm very thankful to the disability community who has really shown me like what it means to embrace disability and our culture and our history and the way we navigate our world. And I kind of want to briefly give a comment about how I navigate the medical system, because one of the things I'm very fortunate of, and I know a lot of folks don't have this experience, is that my doctors, both my primary and my orthopedic physical medicine doctor, they are very supportive with my uh, career as a dancer. I think that has been very empowering for me to continue this path. And I've had a doctor who wasn't necessarily in agreement with what I'm doing, but I obviously had to change that doctor because that was not good for me emotionally, as someone who has anxiety as well. So I think it's important for physicians to understand disability through that context. Like, it's not just a limitation, but it's also a way of living. There's a lot behind that. Yeah, those are my thoughts. Thank you, San, for
Thank
this
you,
amazing
Vanessa.
opportunity. Yeah.
Thank you, Vanessa.
If anybody has any questions, let us know. We're coming up to the end of our hour here. And in the meantime, I'm going to hand things off to Dr. Schaff.
Thanks, Ted. Thank you so much, San and Pamela. This was such a really important and thoughtful conversation and a beautiful tour of the work. I think one of the things that struck me so much is what Pamela said about, really seeing another, that's at the heart of all of our clinical work. And I think, what a perfect answer to kind of Ted's question about what does it take to do, I think, broadly speaking, clinical work. And first and foremost, you have to see another and see who is in front of you. And what San's work does, I think, is let us see better. We get to see through this project experiences and repertoire, routines, rituals, as you say, as repertoire, but as a means of learning more about someone else and about being able to do work, clinical work in that context is really special. So I just want to thank both of you for making me understand something a little differently than I have before. That's what I love about this series. I always feel like we learn more about how to be better at the work we do. So thank you. And we do have time for a question if anybody has any comments or questions.
And in the meantime, I'm just going to say, if you have a chance to go to San's website, it is quite an impressive project. The amount of effort and time and video and participants, and I think it says a lot about her that she made so many people feel comfortable that they would volunteer not just their stories, but their bodies, physicality, letting us see what's going on with them.
Yes. Yeah.
Go ahead, Son.
No. Just yeah. Oh, thanks, Erin, for there's the link in the chat. Yeah, like as I mentioned, because now I'm trying to make like this work is still in progress. So I'm open to suggestions and feedback, or if you know of anyone who, who with certain kind of routines, or experiences that you think may be suitable for the project, please let me know. I think that's, I try to ask around.
And I'll say I love this work too for kind of a selfish reason, because one of the things that I'm seeing a lot in the clinic now is with everyone's life changes over the past 1+ years, we're not recognizing how our bodies are moving, and that stress that we're feeling, those extra barriers, not having the commute, not having the walks that we usually took, all those changes are just manifesting within our bodies. And so a lot of what I'm working on with patients, especially with migraine, with TMJ dysfunction, with just any issue, is to recognize what your body's doing and stop doing the things that might be not beneficial for it. Just sort of exist better is what I've been saying over and over. Just like exist. You don't have to fight for your existence. You can just be, and recognizing that is the first step, recognizing what your body is doing in response to all of this. I have a patient that's sitting like this all the time and she has frequent migraines. So I'm like, okay, well, maybe we do this instead. Just recognizing how you can maybe alter your routines. And with this imagery of the lights and using the video, I very well might be pulling this up to show my patients to get them to think about their movement in a different way, instead of just existing in a body, that they're actually, they're dancing, they're kind of moving through space more beautifully than.
Yeah, I totally, I think one of the things that came, like one of the silver lining with, being diagnosed with cancer was I learned to be in touch with my body. So I never really pay attention to it. So I think, to deal with some of the changes, but also my, being anxious about it. I have, I learned about meditation, which is like the mind, but then it's the mind and the physical body is so connected. And I think just having to do these like long massage, it's like, okay, I have to feel my whole body. And that's something I never, ever do before. Yeah.
All right, well, that might be it. We have.
I think there's a question in the
Oh,
chat from Terry, is it? Yeah. Or.
Yeah. How did you learn to work with the lights and create the beautiful images?
Well, I'm a photographer, so I know about how to measure light, but I was doing a lot of experimenting. So I didn't know how long I would need, but I also envision, like when I meet someone, I talk to them and they tell me their routines. So I envision, I think about like, okay, what could be created? What, as an image. So how do I translate that routine into an image that, whether it's a portrait or whether it's movement? And then I try to like kind of problem solve. Okay, if it's in the water, what do I do? How can I waterproof it? Yeah.
That's great. Well, thank you so much. And Ted, thanks to you always for your masterful facilitation of this conversation. It's just wonderful. And I can't wait until sometime when we can exhibit your installation or some portion of it in our gallery sometime down the road.
That would be great. Yeah.
Thank you.
Thank you.
Bye-bye.
Bye,
Thank you.
everyone.